People throughout centuries have known that the leaves of certain plants, fermented fruit juice, or certain kinds of mushrooms, for example, could produce feelings of well-being or altered states of consciousness. The DSM-5 no longer uses the terms substance abuse and substance dependence. Rather, it refers to substance use disorders, which are defined as mild, moderate, or severe to indicate the level of severity, which is determined by the number of diagnostic criteria met by an individual. Substance use disorders occur when the continual use of alcohol and/or drugs causes clinically and functionally significant impairment, such as health problems, disability, and failure to meet major responsibilities at work, school, or home. According to the DSM-5, a diagnosis of substance use disorder is based on evidence of impaired control, social impairment, and risky use, and pharmacological criteria. Alcohol use disorder is the most common substance abuse problem in the United States. About 66% of American adults occasionally drink alcoholic beverages. 12% are heavy drinkers. A heavy drinker is described as a person who drinks every day and becomes intoxicated several times a month. Illicit drugs are an increasingly overwhelming problem in the United States. It is especially concerning with the growing knowledge we have of the dangers of these drugs. Marijuana is still the most commonly abused illicit drug in the United States. However, there has been a dramatic increase in substances referred to as club drugs, such as ecstasy and LSD. The abuse of anabolic androgenic steroids, synthetic substances related to male hormones, is no longer associated with just bodybuilders and professional athletes to build muscles and boost athletic performance. Unfortunately, steroid abuse has spread to include school-age children, models, business professionals, and others. Within the course of 2 years, the use of steroids has increased in school-age children over 300%. Nicotine is the psychoactive drug in tobacco, and nicotine dependence is considered the most common form of chemical dependence in the United States today. Research claims that nicotine is as addictive as heroin, cocaine, or alcohol. According to the CDC, more than 480,000 deaths each year are caused by cigarette smoking. Tobacco use and smoking do damage to nearly every organ in the human body, often leading to lung cancer, respiratory disorders, heart disease, stroke, and other illnesses. All patients with substance use disorders share common cognitive deficits and core executive functions. For example, all substance users have difficulty with planning, working memory, inhibition, and decision-making. There are also alterations in selective attention, episodic memory, and emotional processing. The brain is made up of many parts that all work together as a team. Different parts of the brain are responsible for coordinating and performing specific functions. Drugs can alter important brain areas that are necessary for life-sustaining functions and can drive the compulsive drug abuse that marks addiction. Brain areas that are affected by drug abuse include the brainstem, cerebral cortex, and the limbic system. The brainstem controls basic functions critical to life, such as heart rate, breathing, and sleeping. The cerebral cortex is divided into areas that control specific functions. Different areas process information from our senses, enabling us to see, feel, hear, and taste. The front part of the cortex, the frontal cortex or forebrain, is the thinking center of the brain. It powers our ability to think, plan, solve problems, and make decisions. The limbic system contains the brain's reward circuit. It links together a number of brain structures that control and regulate our ability to feel pleasure. Feeling pleasure motivates us to repeat behaviors that are critical to our existence. The limbic system is activated by healthy, life-sustaining activities such as eating and socializing, but it is also activated by drugs of abuse. In addition, the limbic system is responsible for our perception of other emotions, both positive and negative, which explains the mood-altering properties of many drugs. Multiple research articles have examined genetic predispositions to drug dependence. Researchers think that there may be a genetic predisposition to one particular type of alcoholism, the type that begins in adolescence and is associated with impulsive, antisocial, and criminal behavior. With other types of alcoholism, many genes may interact to play a role. Genes may influence traits such as impulsivity, which can make a person more likely to become alcoholic, Genes may also influence the level of dopamine in the brain. It has been suggested that high dopamine levels may in turn influence the susceptibility to alcoholism. Addition to that, addiction refers to compulsive use of substance for psychic effects and to satisfy a craving for the drug. Behavior includes continuing to use the drug in spite of harm to the user, such as legal problems, damage to relationships, or loss of job. The compulsive need to get high from the substance leads to rapid escalation of the dose, as contrasted to the usual slow need for periodic increases due to tolerance. Addiction is considered to be a chronic neurobiologic disease with genetic, psychosocial, and environmental factors influencing its development and manifestations. Pseudo-addiction is a more complex term that refers to individuals who display drug-seeking behaviors, such as hoarding meds, obtaining drugs from one provider, frequent emergency department visits, requests for dose increases because of the unrelieved pain. Once adequate pain medication is prescribed and the pain is controlled, the patient is able to comply with a prescribed medical regimen, and the drug-seeking behavior tends to stop. Comorbidity research is also studying genes that may predispose an individual, either directly or indirectly, to both an addiction and a mental disorder. Table 19.2 in your book shows several physical complications related to drug abuse. Flashbacks are common with individuals that have lived through very traumatic situations. This is also common in people who suffer from post-traumatic stress disorder or PTSD. Flashbacks occur during a person's lucid state, and things that we find completely normal can trigger these events. Typically, you can tell that a person is experiencing a flashback by the rigidity and often frightened look in their face. Codependency is an excessive emotional or psychological reliance on a partner, typically a partner who requires support due to an illness or addiction. The goal for the codependent is to keep the addict happy and make life as simple and stress-free as possible for them, in the hope that it reduces the need for them to indulge in their addiction. Nothing that the codependent does to keep the peace or provide for the partner is considered too much. It tends to backfire as efforts are unappreciated or noticed by someone whose prevailing thoughts are on getting their next fix. Box 19.2 in the book describes several codependent behaviors. Box 19.3 in the book provides an overall assessment guide for substance use patients. The CAGE-AID tool is a questionnaire that is given by healthcare personnel. It was originally created for alcoholism alone, but then adapted to include drug abuse as well. It is 4 to 5 questions, and it takes approximately 1 minute to give and score. If the patient scores high with the questionnaire, the treatment is provided accordingly. I have added a link to a CWAS scale. This is an alcohol withdrawal scoring tool that is frequently used in hospitals and psychiatric facilities. The tool is used to determine treatment for the patient withdrawing from alcohol. It is very important to utilize the medication and treatment for the withdrawal period. A patient may present with seizures, delirium tremens, and sometimes can even lead to death. Delirium tremens often occurs 3 days after the beginning of the withdrawal period and usually lasts 2 to 3 days. The patient often hallucinates, shakes uncontrollably, has high fevers, sweats, and has a rapid heart rate. You'll also want to watch for high tolerance alcoholics. For example, an intolerant drinker may be in a coma with a blood alcohol level of 0.4. The patient that is a daily drinker is walking and talking. This shows a discrepancy between blood alcohol level and expected behavior. Sedation allows for the safe withdrawal from alcohol. Benzodiazepines are the drugs of choice in most regions because of their high therapeutic safety index and anticonvulsant properties. Medications often seen in withdrawal protocols include Ativan, Valium, and Librium. The patient also typically receives IV fluid infused with multivitamins and folic acid and thiamine tablets daily. Table 19.5 in the book gives examples of alcohol withdrawal delirium interventions. Table 19.11 in the book is pharmacotherapy for substance use disorders. Make sure that you know this for the test. When a patient who has ingested a stimulant experiences chest pain, has an irregular pulse rate, or has a history of heart trouble, the person should be taken to an emergency department immediately. Cocaine or crack is extracted from the leaf of the coca bush. When smoked, it takes effect in 4 to 6 seconds. After 5 to 7 minutes of a high, a period of deep depression occurs. This reinforces the addictive pattern. Cocaine has two main effects on the body: anesthetic and stimulant. Withdrawal symptoms from CNS stimulants include depression, suicidal ideation, paranoia, lethargy, anxiety, insomnia, nausea, vomiting, sweating, and chills. Hyperpyrexia and convulsions are common when a patient has overdosed on a CNS stimulant and are a priority in your nursing care. Heroin has become cheaper and more prevalent. Indiana has had several counties as of December 2014 with needle exchange programs. Novices often start by ingesting the drug nasally and eventually are injecting the drug intravenously. Comorbidities that often occur with heroin are hepatitis C and HIV. The veins of heroin users are often scarred and difficult to place IVs and draw blood. Common complications from this drug are wounds, ulcers, and necrotic tissue. Symptoms of opiate withdrawal include muscle aches, abdominal cramps, goosebumps, and feelings of impending doom. Early signs and symptoms of narcotic withdrawal resemble the onset of a flu-like illness, minus the fever. Narcotic antagonists, such as naloxone or Narcan, can quickly reverse CNS depression. However, because the narcotics have a longer span of action than the antagonists, the patient may lapse into unconsciousness or require respiratory support again. Narcan has been in the news lately due to the increasing availability of this drug as a prescription. 14 states are even selling Narcan over the counter. The controversy lays in the idea that people who are not properly trained may be administering this medication and enabling drug users to continue without fear of further complications or death. Naltrexone, or Revia, is used to treat both opioid and alcohol addictions. As an opioid antagonist, it blocks the action of opioids. Because it blocks the mechanism of reinforcement, it also reduces or eliminates alcohol cravings. Some common abused inhalants include cleaning solvents, spray paint, glue, cigarette lighter fluid, gases used in aerosol cans, and markers. Young teens often abuse inhalants because they are typically found in the home or can be easily purchased. Inhalant use is also referred to as huffing or backing. When inhalants began to hit the news, many stores started checking an identification of age before purchases could be made. Most abused inhalants other than nitrates depress the central nervous system, similar to alcohol. The effects are comparable, including slurred speech, lack of coordination, euphoria, and dizziness. Inhalant abusers may also experience lightheadedness, hallucinations, and delusions. With repeated inhalations, many users feel less inhibited and less in control. Some may feel drowsy for several hours and experience a lingering headache. Perpetrators use these drugs because they rapidly produce disinhibition and relaxation of voluntary muscles. They also cause the victim to have lasting anterograde amnesia. Alcohol potentiates their effects. Achieving sobriety is only the first step toward what will be a long and complex recovery. It is felt that in order to be successful, the treatment program has to focus on many aspects of the person's life that have been altered by the addiction. Examples will include the individual's medical, social, vocational, legal, and psychological needs. Psychotherapy assists patients in identifying and using alternative coping mechanisms to reduce reliance on substances. Eventually, psychotherapy can assist recovering addicts to become increasingly comfortable with sobriety. Cognitive behavioral therapy helps patients to recognize and avoid old triggers to using and offer behavioral strategies to cope with situations that are most likely to induce cravings and abuse of drugs. Motivational incentives in therapy offer positive reinforcements that are provided when a patient participates in counseling sessions, maintains a therapeutic drug regimen, and remains drug-free. Group therapy is an extremely important element of recovery for most individuals with substance use disorders, such as 12-step programs. Alcoholics Anonymous, or AA, is the prototype for all of the 12-step programs that were subsequently developed for many types of addiction. These programs offer the behavioral, cognitive, and dynamic structure needed in recovery. 3 basic concepts are fundamental to all 12-step programs. 1. Individuals with addictive disorders are powerless over their addiction and their lives are unmanageable. 2. Although individuals with addictive disorders are not responsible for their disease, they are responsible for their recovery. And 3. Individuals that can no longer blame people, places, and things for their addiction. They must face their problems and their feelings. Self-Management and Recovery Training, or SMART, is also a self-help program. SMART is rooted in cognitive behavioral therapy. The program emphasizes the following 4 key points. 1. Enhancing and maintaining motivation to abstain. 2. Coping with urges. 3. Problem solving, managing thoughts, feelings, and behaviors. And 4. Lifestyle balance, balancing momentary and enduring satisfactions. Residential treatment programs are best suited for individuals who have a long history of antisocial behaviors as well as addiction. The goal of treatment is to effect a change in lifestyle, including abstinence, development of social skills, and elimination of antisocial behavior. Intensive outpatient programs are substance abuse and addiction programs that take place in the community. These addicted people follow an intensive outpatient program including a variety of psychotherapeutic and pharmacological interventions along with behavioral monitoring. Outpatient drug-free programs are better suited to an individual who is simultaneously addicted to 2 or more drugs and/or alcoholic abusers. These centers may offer vocational education and placement, counseling, and individual or group psychotherapy. Box 19.6 in your book details relapse prevention strategies. Unfortunately, there are not enough of these resources in our communities. People are unwilling to go far away for treatment and support, even though it's for the best, and addictions continue. Spiritual practices are related to improved outcomes. Higher spiritual levels often correlate with a sense of purpose, gratitude, and forgiveness, which are all aspects of spirituality. Up to 20% of practicing nurses are addicted to substances. That would be approximately 1 in 5 nurses practicing today. Student nurses are just as vulnerable to these addictions. Mandating punitive action makes it more difficult for impaired nurses to seek early interventions and assistance, which makes it more likely that the public will be endangered. It also makes it more difficult for colleagues to report a fellow colleague. However, in helping colleagues and students recover from addictive disorder by providing a non-punitive atmosphere is a life-saving first step for nurses, students, and those in their care. Therefore, the alternative to discipline programs appear to be as effective as, if not more than, the traditional approach to reporting addicted healthcare professionals. Researchers state that one of the benefits of the environment is that it allows managers to remove nurses from the workplace quickly, unlike traditional disciplinary procedures that can extend for months to years. These programs are to help impaired nurses recover from addiction, reduce the chances of dismissal, and return nurses to work under strict monitoring guidelines with random substance checks, support, and meetings with managers and regulators to ensure compliance.